A blood pressure cuff that is too narrow can cause a falsely elevated blood pressure reading. When preparing a single injection for a patient who takes regular and neutral protein Hagedorn insulin, the nurse should draw the regular insulin into the syringe first, so that it does not contaminate the regular insulin. Gavage is forced feeding, usually through a gastric tube. A tube passed into the stomach through the mouth. According to Maslow's hierarchy of needs, physiologic needs air, water, food, shelter, sex, activity, and comfort have the highest priority. The safest and surest way to verify a patient's identity is to check the identification band on his wrist. In the therapeutic environment, the patient's safety is the primary concern. Fluid oscillation in the tubing of a chest drainage system indicates that the system is working properly. The nurse should place a patient who has a Sengstaken-Blakemore tube in semifowler position. The nurse can elicit Trasow's sign by occluding the brachial or radial artery, hand and finger spasms that occur during occlusion indicate Trasow's sign and suggest hypocalcemia. For blood transfusion in an adult, the appropriate needle size is gauge 18 to 20. In an emergency, consent for treatment can be obtained by fax, telephone, or other telegraphic means. Decibel is the unit of measurement of sound. Informed consent is required for any invasive procedure. A patient who can't write his name to give consent for treatment must make an X in the presence of two witnesses, such as a nurse, priest, or physician.